Welcome to Special Education with Hamid Naqvi. Let's continue practicing MCQs relating to mentally challenged field. First question is, which of the following is commonly used to assess adaptive behaviors in individuals with intellectual disabilities? Stanford-Binet Intelligence Scale, Vineland Adaptive Behavior Scales, WISC Wechsler Intelligence Scale for Children, or MMPI Minnesota Multiphasic Personality Inventory. Correct answer is Vineland Adaptive Behavior Scales. And Vineland Adaptive Behavior Scale, we know, assesses adaptive behaviors, including social, practical, and conceptual skills, making it a widely used tool in evaluating adaptive functioning for individuals with intellectual disabilities. What kind of sport is typically given to individuals with profound intellectual disability? Minimal supervision, specialized medical and personal care, only educational support, or independent living skills? Correct answer is specialized medical and personal care. And the reason is that people with profound intellectual disabilities often require 25 by 7 supervision, extensive medical care, and assistance with basic life tasks like feeding and bathing. Specialized support is necessary to ensure their well-being and quality of life. Next question is, which of the following professionals is often involved in helping individuals with intellectual disabilities improve their communication skills? Neurologist, speech language pathologist, physical therapist, or radiologist? Correct answer is speech language pathologist. And we know speech language pathologists help individuals with intellectual disabilities develop communication skills, which can include speech, understanding language, and nonverbal communication. Which condition is caused by a deletion of genetic material on chromosome 7 and is characterized by intellectual disability and unique elfin facial features? Engelmann syndrome, Williams syndrome, Prader-Willi syndrome, or Rett syndrome? Correct answer is Williams syndrome. The reason is that Williams syndrome is a genetic disorder caused by a deletion on chromosome 7 and is associated with intellectual disability, unique facial features, and friendly, sociable personality. Next question is, which IQ range is generally associated with severe intellectual disability? 50 to 69, 35 to 49, 70 to 79, or 20 to 34? Correct answer is 35 to 49. And the reason is that an IQ range of 35 to 49 typically indicates severe intellectual disability. Individuals with this range often require significant assistance with daily living activities and benefit from specialized support. Which of the following approaches is most helpful in teaching life skills to individuals with intellectual disabilities. Abstract discussion, step-by-step instruction with practice, self-study methods, or competitive learning environment. Answer is step-by-step instruction with practice. A step-by-step approach with clear instruction and practice is effective for teaching life skills to individuals with intellectual disabilities. This method allows them to learn and retain skills through repetition and guidance. Which of the following condition is a chromosomal disorder that often results in intellectual disability, distinct facial features, and may cause heart defects? Turner syndrome, Down syndrome, Marfan syndrome, or Fragile X syndrome? Answer is B, that is Down syndrome, because Down syndrome is caused by extra copy of chromosome 21, is associated with intellectual disability, characteristics, facial features, and potential heart defects, among other health conditions. Which type of early childhood program is aimed at enhancing developmental outcomes for young children with intellectual disabilities? General education classrooms, early intervention programs, advanced placement programs, or honor programs? Answer is early intervention programs. Early intervention programs we know are specialized programs aimed at improving developmental outcomes for children with intellectual disabilities. These programs focus on language, motor, social, and cognitive skills. Next question is, which skill might be included in a practical skills training program for adults with intellectual disabilities? Financial planning, reading complex literature, advanced mathematical problem solving, or public speaking? The answer is financial planning. The reason is that practical skills training often includes tasks like basic financial planning, such as managing money and budgeting, which helps adults with intellectual disabilities achieve more independence. Next question is, which category of adaptive behaviors skills involves tasks such as cooking, cleaning, managing transportation? Conceptual skills, social skills, practical skills, or creative skills? The answer is practical skills. And we know that practical skills include everyday tasks necessary for independent living, such as cooking, cleaning, managing transportation, and personal care activities. These skills are essential for adapting to daily life. Next question is, which of the following therapies is often beneficial for improving social skills in individuals with intellectual disabilities? Play therapy, speech therapy, social skills training, or psychodynamic therapy? The answer is social skills training. Social skill training, we know, focuses on improving communication, social cues, and interpersonal interactions, which are essential for individuals with intellectual disabilities to navigate social situations. Next question is, intellectual disabilities are often diagnosed when the child reaches adulthood, shows average or above average academic performance, has an IQ above 100, fails to meet developmental milestones in early childhood. The answer is the last one, that is, fails to meet the developmental milestone in childhood. Intellectual disabilities are frequently identified in children who do not reach expected developmental milestones such as walking, talking, or learning basic concepts during early childhood. Another question is, which of the following IQ scores ranges typically corresponds with moderate intellectual disability? 50 to 69, 35 to 49, 20 to 34, or 70 to 79. 35 to 49 is the correct answer, because an IQ score range of 35 to 49 generally indicates moderate intellectual disability. Individuals with moderate intellectual disabilities often benefit from structured environment and support for early activities. Next question is, which of the following is not a characteristic typically associated with Fragile X syndrome? Intellectual disability, social anxiety, advanced verbal skills, or behavior challenges? Answer is advanced verbal skills, because individuals with Fragile X syndrome often have intellectual disabilities, social anxiety, and behavioral changes. However, they typically experience language delays and challenges with verbal skills rather than advanced verbal abilities. What does the adaptive behavior component of intellectual disability assessment measure? Emotional stability, physical health, skills in practical, social, and conceptual areas, or academic knowledge only? The answer is C, that is skills in practical, social, and conceptual areas. Adaptive behavior assessments evaluate how well individuals manage practical, social, and conceptual tasks necessary for daily living. These skills are crucial for independent functioning and are part of intellectual disability diagnosis. Which of the following disorders is associated with a higher risk of self-injurious behaviors and severe intellectual disability? Williams syndrome, Rett syndrome, Engelmann syndrome, or Turner syndrome? Correct answer is Rett syndrome, and we know Rett syndrome, primarily affecting females, is associated with severe intellectual disability and may include self-injurious behaviors, motor difficulties, and loss of communication skills. Which term describes the consistent and ongoing help provided to individuals with intellectual disabilities, often based on a structured plan tailored to their needs? Crisis intervention, independent support, continuous support, or intermittent support? The answer is continuous support. Continuous support is structured, ongoing assistance given regularly to individuals who require help and daily functioning, and is common for those with moderate to severe intellectual disabilities. Next question is, what is the purpose of positive behavioral support in helping individuals with intellectual disabilities? To punish inappropriate behavior, to support the individuals with developing socially appropriate behavior, to promote competitive behavior, to improve academic skills? Correct answer is to support the individuals in developing socially appropriate behaviors. And positive behavioral support, PBS, focuses on understanding and addressing the root causes of developing behavior using positive strategies to encourage desirable behaviors and improve social interaction. Next question is, which condition is characterized by intellectual disability frequent laughter, and generally happy demeanor. Prader-Willi syndrome, Engelmann syndrome, Fragile syndrome, or Williams syndrome. Correct answer is Angelman syndrome. Angelman syndrome is known for a happy, excitable demeanor and frequent smiling or laughter, alongside intellectual disability and other symptoms like speech impairment and movement challenges. In the context of intellectual disabilities, what is the role of occupational therapy? To improve emotional stability, to assist with basic physical mobility, to teach self-care and daily living skills, to conduct IQ testing. Answer is to teach self-care and daily living. Occupational therapy helps individuals with intellectual disabilities develop practical skills needed for self-care and daily tasks such as dressing, feeding, and personal hygiene, promoting independence. Best of luck. See you in the next